from this side, we have the holder for the cover and the temperature probe. From this side, we have the printer to add. Just get the roll, insert here, and pull. It's ready for printing. Now, from this side, also here, we have the power connection. Remember this system does not work on electricity, on power. I mean, if the battery is completely empty, even if it's connected to the power and you turn it on, it will not work.
Okay.
Just give it 15-20 minutes to charge a little bit, then turn it on, it will start. Keep it all the time connected to the electricity, never mind. There is a sensor. When there is a need, it will start charging. When there is no need, it will stop charging. Okay? Then once the battery is full, it will be, actually it's much more. It will be enough to do you at least 40 measurements for all non-invasive blood pressure, continuous SpO2, and temperature. Okay? Then to start the system, just go for the blue button here to turn it on. Connect the cuff. Where is it? Connect the cuff to the patient, and then press the green button.
Yes.
Then after this, connect the SpO2 sensor and the temperature. We will talk about connections and how to do this. Then, if you wanna, let's say, if you wanna monitor a patient, you have a patient and you wanna monitor for 1 hour, let's say, every 5 minutes. So instead of coming here every 5 minutes, so we can go for cycle to set the auto mode. To go for the auto mode, just press cycle. So here we have the time interval. It's 1 minute, 2, 3, 4, 5 minutes, 10, 20, up to maximum of 120 minutes.
Okay.
Like here on 15, so now every 15 minutes it will take a measurement and it will be saved. If you want to print the last measurements, just go for print here, and once you press it, it will print you only the last measurements on the screen. So you will get a short, very short paper. The patient date, patient's name, we have to fill it manually.
Yes.
We have the comment, if you have any comment, manually you have to put, because we cannot admit any information. And then we have the time and date and the parameters. Down you will get the parameters. Now, let's say we have monitored a patient for 1 hour for every 5 minutes. So we have for 1 hour, it's 12 times. We have 12 5 minutes, right? If you want to review, just go for history here and press history. When you press history, it will show you here instead, let's say 0. This means that the measurements was taken 0 minutes ago, just now. If you press it more, maybe you will see like 1 column 30. This means it was taken 1.5 hours ago. The system will save 24 hours and for 200 measurements. After 24 hours, it will be deleted. Or if you want to delete manually, just go for history and press it until you hear this sound. It's less than 1 second. You will hear this sound. So the whole history which is saved, it will be deleted. So now we can monitor a patient. Now, if you want to print which is saved in the history, just go for history and press print. It will print you the last 24 hours, all which is saved. The system, as I told you, it saved 200 measurements. So if we have 200 measurements, we will get a long paper for the whole 200.
You can select one cycle.
No.
It's not accurate, sir, since there have no name of the patient, so no need to print at all.
Actually, yes. Yeah. Well, that's why between patients, if you have a patient you want to monitor for 1 hour, for example, it's recommended to delete everything and start monitoring your patients.
From where? How to delete? Here it is.
From history, just keep pressing less than 1 second until you hear the sound.
It is
so it will delete everything. Okay, on the other side here we have the yellow button. This is to silence the alarm for 2 minutes. We have here the alarm setup. Just select what parameter you want to have and then you can change the limits. Like here, the high pulse rate, we can increase, decrease. We have the menu here for the pressure inflation. What will happen here? Let's say we have set it for 125, and you put to the patient and you start the non-invasive. It will inflate the cuff until reach this number, and then stop, detect. If there is a pulse, means pressure is higher. Automatically, it will keep inflating. There is no pulse, means pressure is lower. It will start measuring. Okay. Then we have the alarm volume and pulse volume. So this sound you will hear once we connect for the pulse. Now we have, this is the cable for the SpO2, non-invasive blood pressure, and the temperature probe. On the screen you will get systolic, diastolic, and mean pressure, pulse rate. Pulse rate, actually, if you connect the SpO2 sensor, you will get a continuous pulse rate reading. If you did not, and you start only the non-invasive, so it will show you here a single measurement of pulse rate, which is taken during the non-invasive.
So we don't have RR in that.
No. Most of RRs, is taken by impedance. You need ECG. We have no ECG here. All right. To get an accurate measurement for the temperature, let's start with the temperature. So just put in the cover, and do not start here sublingual to the front. Here, it's wrong. It will not be accurate. To go for it, to get an accurate reading, so go for the inner angle, sublingual, here, left or right, never mind. But here it's not correct. Then after we finish, just in garbage, not here.
Yes.
Yeah, suppose.
Well, in your pocket, maybe.
Yeah, and the press to release, so it will be released. Now for the cuff, for the non-invasive, and we have a lot of complaints coming from the end user.
Yeah.
And it's only because they are not following the instructions on the cuff. Not only for our device, for all electrical device you are going to use. There are some signs on the cuffs. The first one is the arrow. This arrow must be at the artery, so it must be here, not anywhere.
Yes.
Then we have index line. This index line must go inside the range here. So here it's too big for the patients. Here it's too small for the patients. It will gives you a measurement, but it will be not correct. So it must be, this line must go inside here only. And then sometimes once the cuff becomes old and we start inflating, it will start to open. Never try to fix with your hand, because even if you have touched it, we are giving a pressure against, so it will be detected as patients. So it's not correct. Stop the measurements, fix it well, and then start again. Okay? And the last thing, in between patients, if different patients, just turn off and on the system. It's recommended. Because the first measurements, it will be considered as a reference, and the next will be referred to if different patients, so we are giving a wrong reference for. So turn it off and on. It's few seconds. It's seconds only, 2 or seconds. Now it's ready. Okay. So this is for the.
We must have other
Sir,
size.
do we
Yes.
have any Dynamap set for pedia?
What you mean for the cuffs?
Yes.
Yes, actually we have those sizes all,
So it will
and
be provided.
it's all included. This question maybe someone from the hospital will answer you. I don't know.
So how
what
to
the
What?
size you
remove the
would
cup
like.
in just case that we have a cup for pedia, we'll just pull it up.
Sorry?
How
To
We
remove?
need to
this?
change.
To remove, it's
Okay,
a
okay.
pen. Just remove.
That's good.
What's your question? For pedia?
Pedia, sir.
Yeah, okay, for pedia size?
Yes.
Oh.
Pedia.
I think it is fit for all.
This actually you can use. It's only for the adult. This one is
Yes.
for the
They
adult.
will not-
There is a small adult
Yeah.
which is you
Yes.
can use for pedia adult, and those for
Yeah.
for pedia and for neonatal. For neonatal, actually, if you are going to deal with the neonate, you must change all these hose. There is a light blue one. That
Just
blue
for
one
neonate.
is for the neonatal.
For infant, no. Just
For pedia, no.
Okay.
Okay.
Finished?
So,
Yeah, and then